Welcome to today's Explainer, where we're going to break down an incredibly exciting remote utilization management pharmacist role and turn it into a crystal clear career blueprint for you. We'll be looking closely at the specific requirements for this position so we can understand exactly what the job entails, what your day-to-day workflow would actually look like, and the strict qualifications you need to land it. So if you're a pharmacist looking for a serious career pivot, you'll definitely want to pay close attention to these details.
Okay, let's dive right in. Now, this remote role offers a fantastic opportunity for those of you looking to transition out of retail pharmacy. We all know it can be incredibly difficult to figure out how to leverage a retail background into a remote clinical role. But right out of the gate, this is exactly the kind of move this specific company is looking to facilitate.
All right, Section 1, the pharmacist role.
So the absolutely crucial point here is grasping what this job actually entails. In short, you'll be reviewing client-specific requests and conducting clinical evaluations to ensure everything aligns with clinical intent. Basically, think of yourself as the clinical expert reviewing prior authorization cases. You're looking at specific clinical criteria, the patient's exact plan design, and strict regulatory guidelines. And then you're rendering coverage determinations based on all those factors. It is a high-responsibility role for sure, centered entirely on careful review and strict adherence to guidelines.
But you won't just be looking at standard prior authorizations every single day. You're also going to be reviewing formulary exceptions, you'll evaluate step therapy protocols, and you'll be looking at quantity limit exceptions. This really highlights that the role requires a broad understanding of pharmacy benefits, plus the ability to pivot seamlessly between different types of coverage requests.
Moving on to Section 2, inside the daily routine.
Now, while this is a fully remote position, make absolutely no mistake. You will be operating in a fast-paced and dynamic environment. Working from your living room in this role does not mean a slow, relaxed pace. The sheer volume of those formulary exceptions and prior authorizations we just talked about means you're going to need to be sharp, efficient, and ready to handle a very dynamic workload every single day.
So, what does that daily workflow actually look like? It essentially breaks down into three main phases. First, you gather the clinical and criteria information. You have to ensure absolute due diligence here. Second, you actively consult with healthcare providers or members. You'll be answering their questions about non-formulary and clinical product coverage issues and even advising physicians on appropriate formulary alternatives. And finally, you work within those regulatory guidelines to make an independent clinical decision on the case. You aren't just passing paper here. You are the final clinical decision maker.
And you certainly won't be isolated in this remote role. You'll be constantly collaborating across the team, engaging in regular communication with your team members and supervisors, using Teams messaging, phone calls, and video chats. You're also going to participate in structured touch points to ensure consistency and decision-making across the entire pharmacist team. On top of all that, you'll actually be tasked with training new pharmacists on processes and best practices for reviewing cases in both Medicare and commercial settings. Ensuring Medicare compliance is a massive part of this collaboration.
All right, Section 3, essential skills and qualifications.
Let's look at the non-negotiable baseline requirements to land this. You obviously need a solid educational foundation, so either a PharmD or a Bachelor of Science in Pharmacy. You absolutely must have a current pharmacist license in good standing with the State Board of Pharmacy. And they require at least 2 years of relevant pharmacy experience, which they specifically define as retail, managed care, or clinical pharmacy. On the soft skills side, they're looking for a motivated self-starter with a strong results orientation and someone who can prioritize tasks and manage multiple projects, which ties right back to that dynamic, fast-paced environment we discussed earlier.
Now, here's where the requirements get incredibly exciting and, honestly, maybe a little surprising. Candidates with retail pharmacy experience, think CVS and Walgreens, are actually preferred over those with hospital experience. No way, right? In so many clinical roles, hospital experience is king. But here, the high-volume, high-pressure environment of retail pharmacy is actually viewed as the superior training ground for this specific remote position.
Beyond your baseline clinical background, there are a few extra things that will give you a major competitive edge. Previous pharmacy benefits management, or PBM experience, as well as case or care management experience are highly valued additional skills. Plus, because this is a remote, heavily tech-reliant role, you really need to show proficiency in Word, Excel, and a proven ability to learn new computer systems quickly.
And finally, there is a highly specific hard number technical requirement, 35. You must be able to type 35 or more words per minute. Now, it might seem like a totally minor detail, but think about it.
In a fast-paced environment where you're communicating constantly via Teams, documenting complex clinical evaluations, and navigating multiple software systems to ensure regulatory compliance, your typing speed is a literal bottleneck for your daily success.
As we wrap up this explainer, you really have to ask yourself this. Do you have the specific retail background, the clinical drive, and the technical skills to seize this remote opportunity? You know exactly what the role demands now. From making those independent clinical decisions and advising physicians on formulary alternatives to proving your typing speed and leveraging your retail experience. So the only real question left is, are you ready to build on it?